Thank you so much, Phil. And yeah, we're going to jump over to Dr. Bai really quickly before he has to jump off for another meeting. Go ahead, Dr. Bai.
It does not allow me to share.
Let's see here. It should.
Can you see that?
It should allow you, and maybe because Phil was sharing, can you try again?
Yeah, I
It
did
says
release it. Mhm.
Oh,
Is it letting you?
yeah.
Okay. Oh, we could see your screen.
Okay. 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 So I just now want to show how common mitochondrial ARS gene-related disease in patients tested by clinical exome sequencing at GeneDx. So mitochondrial ARS genes are essential. ARS are essential component of the mitochondrial translation machinery. So of the 37 nuclear encoded human ARS genes, 17 are exclusively targeted to mitochondria, and two other targeted to both mitochondria and nuclear. So totally 19 human ARS targeted to mitochondria. So to facilitate mitochondrial translation, the 19 mitochondrial ARS categorize the specific attachment of each amino acid onto the cognate tRNAs. Now, tRNAs is very important, and very common mutations in mitochondrial tRNA genes. And a few years ago, that's an article they reviewed many published mutations in all the mitochondrial ARS genes and also mitochondrial tRNA genes. Now, the top 5 mitochondrial ARS genes are aaRS2, rARS2, dARS2, GARS, and FARS2. So at the GeneDx, we did clinical exome sequencing for over 500,000 individuals from over 160,000 families. So by exome sequencing, so phenotype-driven analysis using HPO terms, then interpretation just regularly. Here's the result. I calculated, the diagnostic result, our reports, and the genes, totally the 19 genes, only one is autosomal dominant. The others are autosomal recessive. The diagnostic result, some diagnostic, both pathogenic or likely pathogenic, both variants, and for recessive. For possibly diagnostic, one pass or LPass plus one VUS, and unknown both VUS. So here, let's count the diagnostic ones only. Diagnostic ones for this study, we said the top 5, the diagnostic yield is FARS2, GARS, CureARS, rARS2, and VARS2. But the literature I just showed a minute ago, there was aaRS2, dARS2, FARS2, GARS2, and rARS2. this, no, the three are consistent, but the other three are not consistent. So this is we use the same set of data. I think the data should be more reliable. And for the literature, they just collected the published mutations. That one could have bias. So the top 5 most common mitochondrial ARS genes are these 5. So the conclusion is just what I have mentioned. The frequency of diagnostic cases in different mitochondrial ARS genes vary greatly. Some did not have any diagnostic finding. For example, PARS2, we do not have any positive. And TARS2, we do not have any positive, and 4 genes do not have any diagnostic yield. So the top 5 in the five genes I mentioned. Thank you for your attention.
Thank you, Dr. Bai. And can you tell us those numbers that you presented there, what time period were they recently drawn from?
I had slide, that's from all. That's
For
from
all.
2015 to end of 2022.
Okay.
Mm.
Interesting. Thank you so much.
Yeah, thank you.
Thank you so much.